is how can female hormone health be improved by lifestyle change and a plant-based diet? Phenomenal topic. We've talked about that a lot on the show, but I'm really glad that you're here to talk about it today, because this is going to be an episode that I think, Dr. Newman, I want all of our female listeners, the female exam roomies, to share with their significant others, because I'm just going to be asking you questions from the guy perspective. And a lot of times, us guys, we just don't understand. So it's on you today to help us understand, if you're up for the challenge.
I'm definitely up for the challenge, Chuck, and I couldn't agree more. You know, I think a lot more families, a lot more marriages would be a lot happier if the guys knew a little bit more about the hormones that their family members and loved ones have to deal with every day. So yeah, I am definitely up for that.
Okay, well let's raise those health IQs, as I like to say. I guess just based off of the topic of your presentation, I mean, how can the hormones of females, how can they, like, that help there improve if they make some modifications away from that standard Western high-fat diet and sedentary lifestyle into more of a healthier diet where they're up and they're also active?
Yeah, you can make huge differences, and I think a lot of people don't realise that, because, you know, we certainly doctors, you know, we talk about the menstrual cycle, and we talk about periods, and about fibroids, and about endometriosis, and about menopause, but we're not really taught about how our lifestyles can impact these conditions. And, you know, I say conditions, but of course periods and menopause is what every woman will go through at some stage of her life, and it's something that even women don't really know a lot about often before they go through it. And so I think education on this is so important. And yeah, diet is one of the biggest things that we can do in our own lives to help improve our hormonal fluctuations. And as you say, it's not even just about diet. We can do things like movement, prioritizing sleep, looking at our overall well-being. All of these things play a vital role, actually, in helping us to manage our hormonal health in the best way possible.
All right, so let's start with the diet here. Over here, it's referred to as the standard American diet, the SAD diet. But clearly, the fast food fascination is not just limited to within the United States. How much of a role is that playing in the overall health of your cohorts over in the UK?
Yeah, I think that we have a very similar dietary pattern, and over here we don't call it the SAD diet, we call it the Western style diet, because essentially, you know, we're not American, but yes, it's the same thing really. And we see that playing out with our rates of obesity, and it's important as well when we look at other conditions that are related not just to genetics but also to lifestyle, in terms of hormones such as polycystic ovarian syndrome. And I think it's really important to empower women and men to recognise some of these things, because believe it or not, I don't know if you knew this, Chuck, but about 1 in 10 women will actually potentially suffer from polycystic ovarian syndrome, many of whom, maybe up to even 80%, don't even realise that they have it. And so it's really important, I think, not only to be aware of the things that we can do to improve our hormone health, but also just some of the signs and symptoms of these hormonal challenges that we'll have that will help point us in the direction of greater health.
What are some of those symptoms? I mean, if you're talking about 80% don't even recognize that they have it, are we talking about subtle symptoms? What should women be looking for?
Well, if we do a little bit of a backtrack, I think, you know, when we're talking about periods, for example, they've been occurring earlier and earlier in the Western world, and that may well be something to do with our diets. And it's not necessarily just that we are generally taller or healthier or have more access to nutrition. I think premature puberty is also something to be really wary of, because that's happening a lot more frequently. And premature puberty is related to increased risk of heart disease later in life, even adult onset asthma, obesity and diabetes. And so when you go through premature puberty, essentially your periods are starting earlier than they should do, and many children now are potentially starting their periods even as early as 7, 8 and 9, and that would be classed, you know, as premature puberty, and that's something to be aware of as parents. And then, you know, moving through into those teenage years, many teenagers will notice that their periods fluctuate. They may not happen every month like clockwork, and especially in South Asian populations, if you're going through your periods in your teens and your periods are irregular for more than a year, that's actually a fairly important sign, because that could be an indication of polycystic ovarian syndrome. And the things that we look for with polycystic ovarian syndrome are irregular periods, or periods that have been absent for a period of time, as well as sometimes excess facial hair, sometimes excess weight, and there may be sort of more subtle symptoms that you wouldn't necessarily associate with polycystic ovarian syndrome, such as depression or anxiety or sleep disturbances. And the main thing that really drives that is insulin resistance. And so it's a hormonal condition that also predisposes people to type 2 diabetes as well. So I think the main thing that you'd look for would be delayed periods, so periods that are happening less frequently than monthly, and you may also look for other signs of androgen excess, which would be things like perhaps extra facial hair, sort of thinning of the hair on the head maybe, or extra weight that you might be carrying.
None of those sound particularly appealing. I can't imagine. I want to go back to what it was you were saying, though, about women starting their period. You said as young as 7 years old. Is that right?
That would be premature puberty, yes. That's obviously, they're children. They shouldn't be having to deal with these things at that age. And it's happening more often in Western societies, yeah. And I think that it's probably to do with not just extra nutrition, not just the fact that we have more nutrition that we've got access to, but actually I think it's clearly harmful at that age to be going through puberty. And I think looking at the data that we have, although I'd love to see more data, I think there is a link with excess hormone exposures through things like microplastics and things like that in our environments that we haven't really looked at enough, but I think we need to have much more research on.
Yeah, when you use the term extra nutrition, I'm assuming you mean excess calories, and that's just kind of the way that it's interpreted here over in the US, is that right?
Yes, I suppose I do, but not just that. I suppose at times in the past there have been nutritional gaps too, that we've been able to fill nowadays. So things like iodine deficiency, for example, are really common. In fact, in the UK, there's a condition called Lancashire neck, which back in the 1800s used to actually indicate that you had iodine deficiency because of the goiter in your neck, because the soils in that part of the country were very iodine poor, and now of course we have a lot more access to iodine, unfortunately from cow's milk, but also now thankfully a lot of our plant milks are fortified, and we can also get it from supplementation and certain forms of seaweed. So I don't just mean excess food, I also mean that we're hopefully able to fill those gaps in nutrition that we may have had in years gone by.
Obviously as a guy, I'm never going to understand the monthly cycle, the menstrual cycle, but I would imagine though, being that young, I'm just blown away, being that young and having that starting to occur with your body, I mean, that's gonna like freak a young girl out, right?
Of course, especially if they haven't been told what it is. You're basically starting to bleed, you probably think you're dying. This is horrible for them. So yeah, I think more education is needed. It shouldn't just be up to mums to teach their daughters, because there's many kinds of blended families these days, and there's many kinds of families that you can't just rely, I don't think, on mums sharing that maternal wisdom with their daughters. I think it's really important actually to have this education in the school setting as well, so that young girls can understand what they're going through and what to expect, and to learn about sanitary products and how to use them. And in fact, even the word sanitary products, I don't really like, because it implies that you're faulty when you're having a period. I think we should just call them period products, perhaps. That's my opinion.
I mean, it's not so subtle wording. You're not wrong on that. It just conjures up like kind of a weird emotion with it. Sanitary product, right?
No, it's horrible, isn't it? I think we just need to shake this all up and just call it what it is. It's period, and we've got period products.
Yeah, right. I mean, I don't know if the person who thought of that term was trying to eliminate the term period, but sanitary product, that's like 20 times more awkward than a period product, right? Oh my goodness. I
I think
mean,
so.
and what about the poor blindfold gentleman who goes down and he's like, sanitary products, this must mean, like bleach and soap and things like that. And he's on the completely wrong aisle in the grocery store. I don't know.
Yeah, you definitely don't want to be putting that stuff in your
No,
underwear.
no, no. I want to ask you about another condition that is hormone driven. This is one where, I mean, on this show, I was really introduced to it for the first time, and the stories of transformation and health rebounds have just knocked me over. I'm talking about endometriosis. How much of that is driven by hormones and diet and lifestyle?
Yeah, I think endometriosis is a really important topic to educate ourselves on, men and women, because many women go undiagnosed for a long time, and it can actually really affect their quality of life and their fertility if they don't receive a timely diagnosis. So endometriosis is a condition where you get essentially the womb lining, or the endometrial cells, can start to crop up in other parts of the body, usually the pelvis, but it can happen anywhere. Rarely even endometrial deposits have been found in places such as the brain and lungs. And the problem with that is that when you have your monthly bleed and your cycle where you would shed blood through the womb and through the vagina, when you have endometriosis, you have those womb lining cells, those endometrial cells, but they're also bleeding in other parts of the pelvis usually. And that can cause irritation, that can cause localized inflammation, and when it continues without having a diagnosis, you could be left with all sorts of problems. You can have parts of your bowel or bladder sticking together, you could have pain during sex, you could have pain even when you do a poo or a wee, and you can have pain at other times in your cycle. So people can get really confused. Doctors often, or perhaps misdiagnose it as irritable bowel syndrome, because the pain isn't necessarily classically just with your period. You could get it at other times as well. And it's really serious. It can affect women's lives immeasurably. They can have lots of days off sick with horrendous period pain. And interestingly, period pain can even be as painful as a heart attack, because many people, especially those with diabetes, aren't necessarily aware that they're having a heart attack when they have one. And so, this is a really nasty, visceral pain that will, give women a really hard time, and they don't even know that they've got it unless they can seek a proper diagnosis. So it's really important that if you're having period pains that seem unnaturally painful, like really unpleasantly painful, that leave you in bed all day, unable to move, and if it hurts to have sex, or if you get pain when you're peeing or when you're pooing, these are really important signs to go and see your doctor.
Yeah, and I've heard stories that, matter of fact, people have come on the show and talk about their own experience with it. And one woman in particular was talking about having to call out of work and would just lay herself across the back of a chair to put some sort of compression on the cramping. And then when her roommate would get home, she would be like, please just walk on my stomach. And the roommate was like, what in the world is going on? Just do it. Because the pain was so intense. And so to hear you say that it can really mimic kind of the feeling of a heart attack, that doesn't necessarily surprise me. I mean, it sounds horrific, but that is some really intense pain. Again, from a male perspective, I don't think that many of my fellow guys recognize just how painful of a condition that can be.
Yeah, it's heartbreaking, really. And the sad thing is, I don't think a lot of women recognise how painful it can be either. So if they're going through it, and if they're getting pain when they pee, pain when they poo, horrific pain during their periods, even pain when having an orgasm, and they think to themselves, what's wrong with me? They assume, well, it can't be anything wrong, it must just be normal. So many women have come to me in the past and said, I just get these really bad period pains. And then when I go through it with them and actually get a feel for what they're going through, I think to myself, they've been suffering for years, and they've just put it down to being, maybe just overreacting, or just trying to get used to the fact that it must be normal for women to go through this every month, and it's really not. And I suppose the advantage of talking about it on a show like this is that if women can listen and men can listen, and they can sort of pass on this wisdom to each other, so that if someone's really suffering, they can go and get checked out. And the good news is that if you get a timely diagnosis, then you can have medical treatments to help. And of course, as you've intimated, it is helpful to instigate lifestyle changes as well that can improve the pain that you're experiencing. So yeah, there is good news in this, and I'm glad that we're talking about it.
Yeah, I think the biggest turnaround that I heard of was with a woman by the name of Catherine Lawrence Ireland. Are you familiar with her story at all?
I think it's one of the stories that Dr. Neil Bernard has shared, and I loved hearing it. So yeah,
I mean, macaroni and cheese every day, all day. Goes in for surgery for endometriosis. Just a few, I guess weeks, maybe a month or so after going plant-based. Doctor opens her up and closes her right back up. All that's left there is a little bit of scarring, but the endometriosis is gone. The doctor called it a miracle, and her mom called it just a plant-based diet. So, it's incredible to me how someone can abuse their body for so long with this unhealthy diet and lifestyle, and yet, in such a relatively short amount of time, it can repair itself.
It can, yes, although I would give you a caveat to say that many women who are suffering from endometriosis are not necessarily eating in an unhealthy way, and also that that kind of story is super inspiring, and I would love for all my patients to eat a predominantly whole foods and plant-based diet, but sometimes those kinds of transformations are not possible, and I don't want anyone to feel guilty if they've really tried hard and they still end up having some issues. But yeah, it's really exciting to hear stories like that, and it makes us feel, I hope, more empowered that we can make some changes ourselves and get some real benefits. And interestingly, it's not even just about the food. There is some correlation, as I sort of mentioned earlier, with plastics too, plastics exposures, things like phthalates. There have been studies to show a correlation between higher phthalate exposure and higher risk potentially of endometriosis. So that's something to also talk about, thinking about ways in which firstly we could get more research on this, but also from an individual point of view, what can we do to reduce our exposure to these kinds of plastics in our food and in our drink? And I think that would be true not even just for women, but for men as well. There's some research to suggest that BPA exposure, phthalate exposure is associated with potentially higher rate of issues with your sperm count, issues with testicular abnormalities, being born with one testicle. There's also a condition in men called hypospadias, where the wee tube comes out of the penis in the wrong place, slightly lower, and that has all been associated potentially with exposure to plastics. And so we would all do well, I think, to limit our plastics exposures wherever possible.
See, now that's an interesting thing. How, as a physician, do you approach having those types of conversations with your patients? I would imagine that very few of them walk through your doors and are expecting to talk about plastic when they're there for a condition that they completely would disassociate with that.
Yeah, I know, it's tricky, and I think I just take a very pragmatic approach, and it depends on the person, and it depends on I think the kind of conversation that we've been able to open up. Most important thing I think in any consultation is to listen first. And I'm really fortunate because in my practice, I work in a National Health Service practice. I have patients coming to me who don't necessarily expect diet and lifestyle advice at all. So it's actually quite nice to take them by surprise and talk about these things and hopefully empower them. And the beauty of it is they can come back again another day. They don't get charged at the point of service, so if I feel like they need to come back and see me, I'll say, why don't you book an appointment in 2 weeks, in a month, in 3 months, we can review it. It gives them some accountability, it gives them somebody who cares enough to see them again, and it gives me the opportunity to actually take the time when people are kind of receptive to it, take the time to really talk these things through. And you're right, people don't expect to talk about diet, lifestyle or plastics, but I think it's actually quite a relief to them when they can find things that they can really change and improve on. It doesn't have to be everything, it doesn't have to be sort of switching to 100% vegan or taking every possible plastic source out of your life, because these things are really hard, and you know, it's almost impossible to do that overnight. But if we become aware, I think awareness is so key, and that's where I always like to begin.
So some of these conversations, I would imagine, for you are quite interesting. I would imagine that a number of your patients kind of have their heels dug in. I'm not going to change. I'm going to keep living this way. And it can be really hard to try to get that information across, especially when what we were just talking about, they're really ill prepared for that conversation when they came in that day, right? So how do you help move the needle when somebody is really kind of dug in there?
I listen, because chances are, if they're really dug in, there's a reason why, and they may have some fixed beliefs that they want to explore with me regarding their health and things that have happened in the past, reasons why they can't change, and you don't really get anywhere by telling people what to do. You have to listen first. So that's what I spend most of my time doing. And then if you ask the right kind of questions at a time at which they're most receptive, then they'll often come up with the answers themselves.
And I want to go back also to something that you said when we were talking about Catherine Lawrence Ireland. You're like, that's a phenomenal story, but it's not everyone's story. I think, and thank you for saying that, because there are a lot of people who make these transitions and they are expecting that level of healing that quickly. How do you manage a patient's expectations? Because there's somebody right now who I'm very close with who is going through that transformation, and it's just not happening as quickly as they would like. And it's hard for me to sit here and kind of see the angst and the frustration. Yes, they're making progress, but it hasn't been this overnight miracle. How do you kind of taper the patient expectations and keep them motivated?
It's a really good question, and it's very individual. And I think the most important thing is to actually just encourage them to focus on what's motivating them to do it, and also how they feel about doing it. Because if there's a lot of angst and frustration around it, then that's not going to feel good in the body. And what I would love for my patients and for anybody listening to know is that these kinds of changes, sometimes they take time, sometimes they don't. We're all so different. We've got different backgrounds. We've got different levels of hormone exposures. We're talking about hormones right now. You know, we're not all born with the same hormonal milieu. You know, we have potentially microplastics exposures from birth. We have, you know, smoking exposures from birth. We have all sorts of different reasons, physically, emotionally, why we would not necessarily all react in the same way. And of course, also, I think when it comes to things like even weight change, I think it can be really challenging, because people will have done 100 crash diets and they will gain the weight again. And that leaves you in a very unfortunate position metabolically, where your body